Thank you, Daniel, and good morning, everyone. Nice to see you. I was here at the first collaborative, so it's great to be back and to see folks again. And on behalf of our ministry senior executive, Stephen Brown and Lynn Stevenson and Sabina Fogan, I'd just like to also extend their good wishes and pleasure that this event is going forward. So in the run-up to this event, Daniel and Sharon and I were talking about the agenda. And Daniel asked that I come and speak a little bit about the work that we're doing at the ministry with respect to long-term strategic health human resource planning. And I think what you're going to find as we go through the presentation that there's a lot of congruence between what Daniel's raised this morning and what I'm going to cover. Just for a little bit of context, I would say that I had the opportunity last year to go to both a national and an international conference on health human resource planning, crossing physicians, nursing, and allied health professions. And the common theme there was the growing demand for health professionals, both nationally and internationally. And for me, what that struck home is that we are in a global competitive market for folks to fill these positions. And we need to think about strategies that are going to make us desirable for folks who want to go into this work. So just wanted to give you a little bit of a sense of some of the challenges we face. And again, these are the same ones that Daniel covered off. We have changing demographics, increasing health costs, and changing population health needs. In BC, presently we spend about $19 billion a year on healthcare, and it equates to about 46% of the province's overall spending. And why that's important is that is a significant piece of the government's overall budget, and it is one of many services that government provides. So decisions made at the Ministry of Finance and through Treasury Board around budget allocation are made in a context of trying to meet multiple demands in multiple areas. And the issue that I would put forward is that we have to have good data and good analytics to support our decision making and our asks for resources, because we're essentially competing with many other demands that are there. Of that 19 billion, I think it's really important to point out that 70% of that goes into government health spending for staff and for people providing services, and that's across both direct services and administration and leadership and management. And I think this last that is important to recognize is that there isn't a direct line between our spending and our population growth. Actually, the cost of providing healthcare is increasing over the years. And so, you know, it just kind of highlights some of the challenges that we're facing in this environment and how we move forward. So what's our response? Basically, what we've been pushing from a strategic perspective is the need to increase the level of services provided in the community. And that's both in home and community care and inclusive of residential care. That care needs to be patient-centered and based on the population health needs. That to get there, you can't just rely on a single profession. We have to look at how do we use team-based care. And that's because different professions bring different skill sets to that work. And in many parts of the province, we have huge issues with recruitment and retention. So you may want to recruit a particular profession, but in actual fact you can't for various reasons. And so we need to think about how do we optimize and use the staff that are there in the most effective way. And I think one of the most critical parts of this is that we need to keep an engaged, skilled, and well-led and healthy workforce that provides the best patient-centered care. So we have to not only be thinking about our recruitment mechanisms and tools, but also our retention mechanisms. Because as I mentioned earlier, 70% of our budget is in the staff that we have, and we want to make sure that we retain and support and compensate and keep workers safe in their work that they're doing. And so we need to be thinking about that as we go forward as well. So in BC, we do really two forms of health human resource planning. At a health authority level, they do a lot of operational planning about how are they going to fill positions, on an annual basis? What are they? Where do they see some gaps? How are they going to recruit to those? What we've been working on over the last 2 years or 18 months is developing a robust strategic provincial health human resource plan, which essentially allows us to, looking at our current workforce and looking at the population and making a series of assumptions, project out over a longer period of time about what our health human resource needs will be. So we've moved forward on creating an annual provincial planning process, which is rooted in the population and patient health needs. And the reason for that is really our client is the public and the population that needs services. And so we need to put them front and center in our planning process to think about, what are their health needs, what are the services they need, and who are the professionals that can provide that. It has to be based in interprofessional teams. And our planning processes need to think about scenario-based approaches to model the implications for workforces in different service delivery models. And my point really there is the province is not one homogeneous environment with respect to your ability to recruit and retain. There are varying population health needs in different parts of the province. And you do have to think about those things as you build your workforce to be able to support it. Right now, we've got a 3-year health workforce plan that covers physicians, nursing, and allied. Frankly, that's too short. We need to extend out further than that. The challenge we have is that the further you project out, the less of the variables you can control. And things like technology and its impact, or the economic environment and its impact, have the potential for some changes. But we recognize that we do need to be doing it on a further trajectory than just 3 years. And the other critical part here is that, and Daniel referenced this, is that our workforce is not all employed through a single employer. Some of it's through health authorities, some of it's through contracted service providers, and there is this growing private sector of healthcare providers as well, which is adding to, as Daniel indicated in his video, folks who are being trained having options on where they're going to work. So I know this is a little bit hard to read, but just to give you a quick walkthrough, this is what we did in 2017 with respect to health human resources. So what we did this year is we actually issued to the health authorities a directive that they had to participate in a provincial planning process using standardized methodologies and data sets. And the reason we need to do that is we need to have one approach that we can understand the workforce and understand the needs. So we put out the requests, we asked them to submit in both quantitative data and qualitative data. The quantitative data was really, who is your existing workforce across physicians, nursing, and allied? And we asked for qualitative data, what are some of the pressure points that you're experiencing in there? And so that we allowed for them to manipulate the big Excel spreadsheets based on issues such as recruitment issues, service change, if there's a change in how services are being provided, and the ministry's strategic direction, what they anticipated the impact of the policy direction would be. We brought all that information into the ministry. We worked collaboratively with the health authorities in analyzing it all, and we came up with an initial set of findings. And from those set of findings, we've developed a series of draft strategies to address them. Now, those strategies have to be both short-term and medium and long-term in nature. We were just in the process of finalizing that plan, and then we'll be bringing it out in a more formal way for folks to see. But the critical part in this is that we've tried to move to a single process, so everyone's talking the same language. We've looked to collaborate in the development of it, not only with the health authorities and with some of our partners around it. And we need to bring it out and to discuss it with folks. We also recognize in that, though, a plan is just a plan. You actually have to move it into action. And so we're very mindful of that, and you'll see in here in a minute that we have some ideas on where we want to go with it. So out of all of that work, there's a series of priority professions identified. Now these priority professions, this is just a subset of those that are related to home and community care and residential care. The list is actually longer than that because it covers primary care and it covers some of the facility-based issues that the health authorities are addressing. But this gives you a sense of the ones in home and community care and residential care that were identified. And I want to emphasize that these are provincial level priority professions. This is not to suggest that this is an exhaustive list. There will be regional issues, there will be community issues, but these ones were surfaced across the process provincially. And I don't think there's any of those professions on there that will be a surprise to folks. I did want to point out the bottom one around leadership and management, and that is there's a growing awareness that managing a workforce around recruitment, retention, ensuring workplace safety, being able to do change management requires investments in leadership and management as well. And in the context of evolving technology and changes in the services that may be provided in different care settings, you need to be investing in that area as well. So besides the sort of clinically based professions, it was a theme that was identified going forward. So what are you going to do? So the ministry has been working with Daniel, the Denominational Health, the BC Association of Assisted Living, talking through some of these issues over the last year. We've been doing some analysis around it internally. And we've identified both short-term and longer-term strategies. So in the short term, we're looking very closely at doing conversions of casual and part-time staff to full-time positions. Now, this is, from our perspective, has two major benefits. One is it provides obviously greater stability for individuals who are providing these services. The second is we have a belief, based on our analysis, that it would also increase the net number of hours available, presently being able to be used by the existing workforce. So that's a piece that we're in active conversation with the health authorities around. And it's not just about their directly employed staff, but it's also in the private sector and the contracted sector. The second piece, and Daniel referenced this, is around increasing training seats. And so we are in active conversations with advanced education around that. And Daniel kind of intimated this when he was speaking that advanced education coordinates across the province training for multiple different sectors. And so when we go, as the Ministry of Health, to advanced education and say we want to increase the number of seats that are provided for a particular profession, they say to us, well, where's your data? So our planning process now gives us the data. And it allows us to be able to make a strong business argument for why we need to invest in this area. And it's the same for many of those other professions that are on that list. And the secondary benefit also is that data gives us the benefit of being able to make stronger arguments to Treasury Board for increased funding to be able to meet those needs. And so those are, I would suggest, two areas that you're going to see some additional information coming out from the ministry and government over the next little while as we move forward. The second part, and I kind of talked about this also, is the focus on workplace violence prevention and illness and injury prevention. In December of last year, 2017, the ministry released to the health authorities its workplace violence prevention framework and a policy directive to them, which is really slated to look at both health authority provided services and through the publicly funded private sector about these issues, about how do we help to mitigate and ideally eliminate workplace violence. How do we address issues like illness and injury from the provision of work? How do we retain our staff and get them back at work? Now this is critical work. It is not work, though, that you can simply just direct. It has to be done in a collaborative set of relationships. So working with Michael McMillan and HEABC, and working with the unions, and working with BC care providers and other major partners and stakeholders, we're going to start having more detailed conversations about these and looking to move forward on some very specific strategies on how to address these issues in a more meaningful way than we are. So the proposition basically is you need to work on some things in the immediate, and you need to be working on these more systemic issues as well as we move forward. I think the other thing I'd like to say is that our planning process is actually still in development, and there's lots of areas of it that we've actually improved on our data, we've improved on our methodologies, but to be honest, we still have some gaps. And one of our big gaps is in the whole area of that private provider area. We don't have any system level ability to understand how big that workforce is, what proportion of the new grads are being decanted into that area. So we need to think through that. We also know that we need to work closely with our partners on these issues because the ministry has a role in this, but it is not that's not a single role. It has to be done in a collaborative way. The other part that we have to always be mindful is we have to keep it based in population and patient needs. And to that end, the ministry has agreed for 2018 to do a pilot project with Island Health and with Fraser Health in the area of population needs-based planning. We're going to identify 2 communities. We're going to look at the area of seniors care, and we're going to look at how do we actually rethink how we do health human resource planning, coming with the patient really, or the client really at the center of that process. And then how do you bring services from both home and community care and residential care and facility care into more alignment to there. The second part is we have to continue to improve our evidence base, and because our actions have to be based in that area. And so what Daniel's covered is very congruent with what we've seen in the data. So we're all very much on the same page, but we have to make a presentation, and I would argue in some cases an argument to others about that, and so the data gives us that. And the last part, and I've kind of covered this, is simply that we are needing to do this work in a collaborative environment, and that's with our big partners like BC Care Providers, Denominational Health, BC Association of Assisted Living. It's with our major unions, it's with the health authorities. And what we do need to do is find some way to coordinate that in a meaningful way. And so that's some of the work that we'll be thinking through and be having conversations with our partners and stakeholders about, because we need to be able to create provincial tables to have those discussions, to build on the good analysis that's been done. So that gives you kind of a picture of where we're at. And I know the minister will be here, and I'm sure he'll have more to say, and so we'll look forward to that. So thank you very much for your time.